Welcome to the Coronavirus Update Show, first one of 2000 and what year is this? 21. My name is Omari Salisbury, joined by
I'm
producer
Nikki
Barron.
Barron.
All right, Nikki, we got a lot going on today. By the way, man, your home studio just gets like icier and icier, man. I mean, like you're really working that out over there.
Well, thank you. I'm trying. Yeah, I did a full reset of the living room. I feel like every couple months I need to move where the home studio is just for like my own peace of mind. So yeah, now we're here in the living room.
Fantastic. All right. Well, this is for the coronavirus show. This is the first numbers of 2021. Let's get right into it.
Definitely. So our numbers for Washington State, they rose 995 for confirmed cases since yesterday, bringing us to a grand total of 246,376. We saw an increase of 49 hospitalizations, and we lost 23 Washingtonians to the coronavirus, bringing us to a total death count of 3,482. The next number, which is probably the most important number at this point, is our hospital readiness. So readiness is sitting at 86.9, and our goal is 80%. And that is how many hospital beds we have that can treat the coronavirus symptoms. And then the other number that's really important is our positivity rate. So the positivity rate, and this is incomplete data because it takes a while to get all of the positive and negative results. But as of 12/29, we had a positivity rate of 17.8%. And for reference, our goal for the state of Washington has been said that it should be 2%. And for King County, they've been pushing for us to get to 5%.
Right. Wow. All right. So 1 week from today, the state legislature is in session. We already hear, like, there's different groups that said for different reasons they're planning on either occupying the Capitol. On the 10th, they plan to occupy the Capitol because they feel that the Capitol shouldn't be closed, should be open to people. There's other people who are, against the lockdown, and there's other people just overreach of government. What's that looking like as we go into the legislative session next week down in Olympia?
Yeah, so although Washington has seen some of the lowest coronavirus deaths per capita, Governor Inslee has actually been under attack about these mandates that he's put in place by Republican lawmakers in Olympia. So Representative Jim Walsh from Aberdeen is sponsoring House Bill 1029, which would limit the scope of the governor's emergency declaration powers. If approved, it would create a 14-day reauthorization by the legislature, as well as there's a second proposal that's coming through, which is House Bill 1013, which would also rein in rulemaking by state agencies carrying out emergency orders, which basically would curb the health secretary's emergency powers. And when the Seattle Times asked Governor Inslee about this, his spokesperson said that during the pandemic, we've seen many states what happens when decisive action is not taken. Large increases in infections, hospitalizations, and deaths. Falk wrote in an email to the Seattle Times, "Is the focus of the proclamation is misplaced in that the real limitation in our lives comes from the destructive nature of the pandemic itself." Essentially, he's saying we're mad at the wrong people. We should be mad about the pandemic, not about the shutdowns. And it's pretty scary because the last month, we actually saw 2 shootings during some of these protests in Olympia. So it's not looking good out there when it comes to these protests in Olympia.
All right, so we'll definitely be keeping an eye on things going on down there in Olympia. One of the things that people have really been talking about as well is this new what they call variant of the coronavirus strain that people talked about coming out of London. At least that's where the UK where they found it. Now here in the US, and they're saying that there's now a variant of that variant, or what's going on?
Yes, so the new coronavirus variant has officially landed in the United States, and it is the B1.1.7 variant. And scientists are putting it at about a 50 6% more transmissible rate than the original version of the coronavirus. And we're seeing evidence that this new variant is going to create another spike here in the US because other countries like the UK and South Africa are actually seeing huge spikes in comparison to countries that are not having that variant be discovered. And they're saying that, by March 2021, that's going to be the predominant variant in the United States as well.
So when you talk about this new variant, is like what I'm hearing is it's not more lethal, but it's more contagious.
Right. So basically, what this new variant does that's different from the old one is that it increases the amount of viral load in our nose and our throat. So it's more transmissible when we cough, sneeze, or even talk. So it's really interesting. And so it's not going to directly affect the mortality rate in a sense that people will die more often from this variant. It'll actually just tax the healthcare system more, causing us to lose more lives because we don't have enough hospital beds and healthcare workers to combat the increase in the virus.
All right. And moving along then, what is the latest now on the vaccine? I know that the numbers were kind of underwhelming. The government their goal was 20 million people vaccinated by December 31st. I think they fell well below that number. So what's the latest as to how the vaccine is rolling out? And do you think that President Biden, when he comes in, is going to have more of a national approach to it? Because right now it's pretty local.
Right. So it's not like news that this has been a little bit bumpy. But according to the CDC, about 4.6 million people have received the first dose of the coronavirus in the United States. And for reference, the goal was 20 million. So we're pretty far from that goal. And we've only distributed about 14 million vaccines. So when we talk about this and we talk about Biden, I'm hoping that we're going to see a more centralized approach, because that's been kind of the main issue when it comes to rolling out this virus, is that we really are seeing a lack of leadership at the federal level. So these issues are kind of interesting issues to have when we have this really powerful vaccine, 95% effectiveness. But if we can't roll it out in a really smooth way, it doesn't really help us at all. So kind of the top things that people are stating when it comes to why this isn't working is, first, the super cold temperature of the vaccine. So we don't always have areas where we can keep them cold so that they will stay active. So that's the first one. And then the second is that special refrigeration system also takes special training to handle it. And we don't have any funding to actually train people to give this out. And our healthcare systems are taxed because they're treating such high rates of COVID. So doctors and nurses can't even leave, even if we had the money to train them, can't leave their jobs to go get trained to be able to roll out this vaccine. So that's kind of the first thing that people have talked a lot about being an issue. Another is technology. I mean, there are some states like New Mexico and DC who tried to roll out portals for people to sign up. The technology wasn't working. Even the technology that the states use to see when they're getting their next shipment from the federal government is not currently working. So there's a lot of technological issues when it comes to the rollout of this plan, because there is no federal kind of centralized way for people to do this. And another that I think is really important personally, but we are seeing is making a huge impact, and it's that this pandemic is very political. And so there's a lot of states where we're hearing stories coming out where governors and elected officials are actually making statements about the way that the coronavirus vaccine will be rolled out in their states, contrary to the plans that have been in place put together by the health departments for months. And so that's creating a lot of confusion for citizens about who's getting what and when. And it's also, creating sticky situations like the case of Colorado, where there was a lot of unrest about them vaccinating the prison population. And so the governor decided to deprioritize prisoners as well as deprioritize the unhoused and people living in shelters. And so we've kind of gotten into this system where we're prioritizing the politics of the pandemic over the science of the pandemic, which is, pretty stereotypical of the American health system. So we've got this amazing tool we can use, but because we have not invested in public health and we haven't invested in robust vaccination rollout plans, we can't really do much with it.
Right, right. And when you talk about the federal government, what's the word now on relief? Everybody's looking for relief from individuals, small businesses, cities, counties, states.
Yeah, so the federal relief package is kind of an interesting one. So it's over 5,000 pages, and legislators were only given 2 hours to read over 5,000 pages. So as people have been able to catch up on what's actually in there, we're getting some really interesting stories coming out of it. So the first thing is I'll just kind of run through what is included that does apply to most Americans. So first, we're going to get $600 direct payments for every adult and child earning up to $75,000, with smaller amounts going to those making up to $87,000. Unemployment benefits were extended to offer up to $300 per week through mid-March, which will now also include self-employed workers and gig workers. It extended the rent moratorium until January 31st and included $25 billion in rental assistance. There was an additional $10 billion added for child care centers, $13 billion for SNAP assistance, and the agreement also included $284 billion for paycheck protection loans, with $15 billion of that being reserved for live music venues, independent movie theaters, and cultural institutions. There's also an additional $68 billion for the purchase and distribution of COVID-19 vaccines, as well as some money in there for testing. They added $7 billion to increase broadband internet access to help students and unemployed workers. There's $82 billion in funding for schools and universities to assist them with reopening, and $13 billion was included for farmers and agriculture. Sorry, I'm clicking things. But what was also included in this 5,593 page bill were a few really odd things, such as there's a provision in there that now makes all of our meal expenses as a business completely tax deductible. We saw a subsection included that put a ban on doping in horse racing, as well as created additional tax cuts for the industry that is actually predominantly in Mitch McConnell's state of Kentucky. We saw a really interesting one, which made legal streaming a felony. We also saw some funding set aside that was, set so that we could make a warning to China against interfering with the naming of the next Dalai Lama, which I thought that one was really interesting. But we also saw some funding in there set aside for 3 new museums. And there was a provision in there included that will stop surprise medical billing, basically making it so that hospitals have to give you a complete bill of what you're going to have to pay 3 days before your planned procedure, which I thought that was a really helpful one that did really seem related to COVID relief. But yeah, there was some pretty crazy stuff in there. Probably the most nefarious thing we saw was that the money that we're getting, businesses are getting from the Paycheck Protection Plan, is not taxed coming in. And now it's not taxed going out either. So businesses, mostly large corporations, are going to be able to actually write off all of the expenses that they use that money on. And so we're going to see a huge deficit, even worse deficit when it comes to taxes, because these corporations got millions of dollars in paycheck protection money, and they're not going to pay taxes on it or even when they spend it.
Man, I'm glad you're on top of all this stuff.
Yeah,
That's a lot of good info that you got in there. As we get ready to wind things down here, I know you had a lot of topics. Was there any last topic that we didn't hit here that you wanted to touch base on?
No, I think we kind of pretty much hit it all. I really wanted this episode to just be sort of a dive into a couple areas that I get asked a lot about, and that's mostly like, what are we doing here in Washington? Tell us about this new coronavirus variant, the vaccine, and relief. So I think we've hit them all, and I hope this was helpful to everybody to get kind of a sense of what's going on and get reinformed after maybe taking a couple mental health days from the holidays.
Yeah, mental health is key. So when are we back again? We're back, Wednesday, 6:15, right?
Yes, we are back Wednesday, 6:15. I haven't confirmed my guest completely, so I don't want to say who it is, but it's going to be good because it's Converge.
I like that.
You can trust
us. With it. You can trust us. All right, Nikki, Barron, man, appreciate you. Appreciate the information. This is actually an episode right here. So many people, especially around federal aid, that I get questions on too. So I'll make sure and share this and invite our audience to share this episode with your friends. And where can people find our resources?
You can find our resources at whereweconverge.com. Just head over to our COVID-19 resource page. There you will find the video episodes of this show, as well as a link to the podcast. And in preparation for the show, I wrote like 2,500